If you've ever seen the movie Glengarry Glen Ross, where, the Alec Baldwin character is like, ABC, always be closing, right? That was his mantra. My ABC is always be creating, right? Always be looking at the next thing, looking at the market, looking at emerging technologies especially, and seeing what you can create. Even if what you start creating doesn't really lead to anything, the knowledge that you gain from that is the foundation or the seed for your next great idea.
Welcome to the Forward Slash, where we lean into the future of IT. I'm your host, Aaron Chesney, with my beautiful co-host, James Carmen. Today, we're going to be talking about tech entrepreneurship in the healthcare space. I'd like to welcome Rich Schramm, the founder of Fairwind Technologies. Rich has over 30 years of professional technology experience with a focus on internet-based solution design and development. He's worked with web development, architecture, emerging technologies, whole slew of things. He's had several CTO roles for various local businesses as well. Currently, Rich is a tech entrepreneur and a co-founder of Vizabli in Cincinnati. They have launched a new solution called Acute Care Engagement Solution, or ACES, which is working to put hospitality back into the hospital.
Well, thank you. I appreciate the opportunity to be on the show, Aaron. Excited to have a conversation with you.
So, Rich, I'm glad you could join us today and that you're trying to help make the hospital environment better. I recently went to the doctor and I went in and I told him, Doc, you got to help me. I'm a wigwam. I'm a TP. I'm a wigwam. I'm a TP. And he says, I'm going to stop you right there. You're 2 tenths.
Nice.
Yeah. I'm just letting that joke kind of just wash over me, Aaron. I really wanted to enjoy it and just bask in that joke.
Savor it.
The 2 tenths.
That was a first class dad joke for sure.
Yeah, that is right up there. I'm gonna put that in my database.
Well, why don't we jump into it and talk about building solutions for healthcare industry? What kind of special problems do you see, and how is it different than, say, writing normal enterprise software?
Well, there's a lot of it's interesting. The technology landscape in healthcare is very antiquated, surprisingly. And if you get into the industry, you'll understand why. There's a lot of restriction and regulation, and so once a product or a solution gets in place, it's very hard to displace it. Because the amount of work that is involved in vetting and configuring and making sure that solution is doing what it's supposed to do and not anything that it's not.
You mean it's not like what I see on TV with all the fancy gadgets and 3D printing organ parts and all that kind of stuff?
Yeah, I have not, in my experience, seen that. I've seen more, people using 10-year-old PCs, and it's almost like the telegraph days in a lot of places, especially when you get out into the rural hospitals. There's so much regulation that's involved in healthcare, not just the privacy, but with HIPAA and so forth, but you have to worry about FDA regulations and high trust certifications and some of these other things. And so it's a very different beast than an enterprise solution where, if something goes wrong with an enterprise solution, a business is down or may lose some money. If something goes wrong in a healthcare solution, lives are at stake. And so it becomes a much more challenging and a much more highly vetted type of environment. Now, our solution at Vizabli isn't actually a life safety system, but we do integrate with a lot of life safety systems. So we integrate with the healthcare system, the medical record system that they have there, so Epic or whatnot. We integrate with the nurse call system, which is how you call a nurse into the room, and a plethora of other systems. So food nutrition, real-time location, the what they call a PAC system, which brings up X-rays and so forth. We integrate with video conferencing and a lot of technology like that, video translation services. So aggregating all that together and presenting it is essentially our sweet spot. We pull all this data together in our platform, and then we present an experience in the patient room, outside the patient door. So like in the hallway, we replace the door placards with basically touchscreen tablets that showing real-time data about the patient, things like allergies and what the status of the room is, is there a procedure in process, stuff like that. So it's all about taking real-time data from all of these systems and essentially mashing it up and providing the right data to the right people at the right time. We've got boards in the nurse station, and then in the patient room, we actually replace the television with a large 75-inch touchscreen tablet that's mounted to the wall. It looks like a television. It looks like a big television, like a big screen, but it's actually a touchscreen tablet. And then we bring IPTV onto that so the patient can watch television on it on a big screen just like they would the TV, but it allows a lot more interactivity and presentation of real-time data.
So you're getting like dual use out of it. Not only is it the TV for the patient, but it's also like a touch screen for the care providers that are coming in and out of the room.
Exactly. Yeah, that's exactly correct. So right now in most hospitals, you get a health grade TV, and the health grade TV is essentially connected to what they call a pillow speaker. It's like this big god awful remote on a big wire that's plugged into the wall and lets you change the channel and go up and down and stuff like that. It's like a D-pad, like a gaming controller almost. And that plugs into the back of the TV. And a lot of times, when you go into a hotel or a hospital, some data is being presented on there as well as the picture, right? So you get like, this is the people who are on your care team, or, this is when the gift shop is open, whatever the case is. And it's very static data, and it doesn't really have a lot of, it's useful, but it's not great. So we kind of inverted that. And instead of putting medical data onto a TV, we've put TV onto a medical data board. So it becomes a single solution on the wall that can be used for the caregivers as well. So they can come in, they can badge into it with a badge, be able to unlock the board and bring up medical data. They can see x-rays, they can zoom in on those and talk to the patient and annotate on them and all that kind of thing. And then they can, while they're talking to the patient, they can bring up a real-time video translator that comes in from an external service, and they can use the camera and the device to see the patient and do things like sign language or one of any like 250 languages. So, so it's designed essentially for not just the patient, but there's really three segments that we serve: the patient, the patient's friends and family, and the clinicians. And so that's why you'll hear, if you're in the industry, you've heard the term patient engagement solution. This is why we call ours an acute care engagement solution, acute care being like a hospital. Mm-hmm. So it's an overarching solution that includes patient engagement. So the patient can order their food, they can watch television, they can control the lights and the blinds and all of that through our solution. But then there's also components of it that are allowing clinicians to badge in and get access to data that is, protected from other people, be able to interact with that, do rounds, save that data back to the medical record, all that kind of thing. And then at the nurse board, or nurse station where the nurses are monitoring, 30 patients on a wing or a floor. We put that whole census board up there, and we're showing, real time information about the room statuses and, is patient, visitors welcome or not. And that's things the patient can control, as well as, where's the doctor? Is the doctor in? Which room are they in? What warnings and precautions, all on like one large board. So it's really a very, very much a game changer in the healthcare industry, because it really provides a great experience for everybody involved. But we're also the only solution in the market that actually engages with friends and family as well. So we have like a mobile app that friends and family can download. The patient can invite people into what we call their circle of care. And those people get a notification to go download the app and set it up, and they get a special code specifically for that patient. And then when things are happening in the hospital room for that patient, like say people coming in and out of the room, medications that have been prescribed, whatever, the patient can specifically say, when they set up their circle of care, I want my Aunt Betty to only just know when visiting hours are, but I want my spouse to be able to see everything about me and everything that's happening. And then, maybe somebody else only gets a subset of that. And then those people, while they're at home or anywhere in the world, getting real-time notifications about events that are occurring in the hospital room. So it's like they're being kept in the loop. They're seeing what's happening. They can see the educational data that's been prescribed to that patient. They can get a notification that a nurse came in at 3 a.m. and checked on it. Especially if you're a parent, you've got a kid in the hospital, it's critical to be able to keep those kind of ties up. And then when the doctor's in the room and he's wanting to have a conversation with the patient, and that patient wants to bring in other family members, like they were in the room, they can just use the board and select all your circle members and say go. And it does a group video call out to the mobile app. So all these people everywhere in the world now brought back into the room in real time to be part of that solution. So yeah, we've really tried to again put the hospitality back into the hospital to make this an experience. I mean, nobody wants to be in the hospital, right? It's horrible experience for most people. But if we can at least make it better for people, and we can make it better not just for the patient, but their family members and their friends. And the clinicians, we can help save them work, then it's a win for everybody.
So lots of questions. How
Sure.
was the HIPAA, like getting through, because I can imagine like, I'm giving access to my, my care information to different people through a system. How reluctant are the hospitals? Like, how did you get through this complies with all the HIPAA regulations and all of that fun stuff? How was that experience for you?
Well, and before you jump into that, I just want to clarify that HIPAA is like all the personal protection Information Act stuff for your health records and stuff. If you're not familiar with the term HIPAA, I know we use it a lot in technology for protected data, and it's really important to us. But if you haven't heard that term before, that's what we're talking about.
Yeah, there's a lot of acronyms in not only technology, but healthcare technology.
Mm-hmm.
So we also hear PHI for personal health information, and PII for personal other information. So there's a lot of that. And the HIPAA is actually an interesting creature, because there is no certification for HIPAA. And this is one of the things that I found very interesting when I got into the industry. And I think it's pretty smart the way that the government, if you can believe the government did something smart, the way that they structured this, because in the past, you would put in regulations, and by the time those regulations were actually enacted, the technology had already moved on. And so what they have done with the health insurance Privacy and Portability Act. I think that's what it stands
Something
for.
like that. Portability Privacy Act. Yeah.
Yeah. The what it has done is they've put in basically guidelines that have said there you have to meet commercially reasonable standards of protecting this patient health information, and you have to do certain things like end-to-end encryption. You have to have audit trails, so anytime that the data is updated or released or displayed anywhere and so on and so forth, that it needs to be audited. And there's some other set of guidelines, but there's no actual certification process. There's no body that comes in and says, this is HIPAA compliant or this isn't. As long as you meet these kind of general requirements, you are essentially HIPAA compliant. So there is no HIPAA certification. A lot of the privacy things come from the hospital itself. And so, there are some hospitals that are very much about like outside the patient room door, we display the patient name. And our system is designed very, very flexibly so that the hospitals can decide how they want to display that name. Do they want to put the first letter in the last three of the last name? Do they want to reverse that? Do they want to put the whole first name and no last name? So all these different ways that hospitals want to do it. Do they want to have no name at all on the board? And sometimes the medical record will say if this person is a VIP or maybe a victim of domestic violence, they don't want to have the names displayed at all outside the door. And so the system has to account for all of these different scenarios. Some hospitals are okay having like a list of allergies outside the door or a list of upcoming medications displayed inside the room. Some of them only want to say when the next medication is coming and not what those medications are. Some people want to have the real-time vitals. That's what's called telemetry. And so we integrate with telemetry systems. And so we can put right there on the board in the patient room all the hemodynamic data about, your blood pressure and pulse and temperature and respirations and all that. Some hospitals want to display that, some don't. Some want to have that on the board, but only behind a protected page. So each hospital has its own very distinct set of rules regarding data that they want to keep private and not. And so our way of being able to deal with that, obviously we do all the end-to-end encryption. We basically do all of the audit trails. We're behind the firewall. So we actually run in-house in most cases, and not up in the cloud, except for the video conferencing aspect, which is necessary in some cases to be up in the cloud, but just that piece of it. But overall, the solution has to be adaptable, but at the same point in time, it can't be a custom built for every hospital, or we'd never be able to get anything done. So we've had to take a very dynamic approach of giving everybody the ultimate flexibility, how you want to lay out your screens, what they look like, all of that stuff, what data you want to be able to display, how you want to be able to display it, when it should be displayed. It's a very, very significant admin component that's part of that allows for all that. And that's essentially how we have been able to satisfy the HIPAA requirements for privacy and also the hospital's handling of PHI and stuff like that.
So one thing that, we've known each other a long time, Rich. So we worked together back in the day, a long time ago, a few years ago.
Forever ago, yeah.
Forever ago. How did you get into this world, and how did this become an area of interest for you? To my knowledge, I don't remember you being from the medical industry, or maybe your parents that were doctors or anything. How did this come to be?
Yeah, it's kind of an interesting story. So I actually started. I left industry to become an entrepreneur back in the mid-teens, and I developed a solution that was near and dear to my heart because I have kids that are neurodiverse, both autism and ADHD, and a whole section of my family is like that. And probably I know I was never been diagnosed, but I was probably the poster child for ADHD when I was in school. I certainly put the H in ADHD when I was a kid. So I designed a solution for families that wanted to be more needed more help in managing their family and their children and making sure their children were getting stuff done, because we had the same problem. Our kids were, they really wanted to do well. They just, struggled with getting things done, getting it done on time, remembering to do things. And so I created a solution that was designed to help in that, and brought it to market, and it has not yet been successful. And so I once we launched it, we put it on the back burner. I realized I wasn't going to be able to, at that point, sustain my family with the revenue from that. And I learned a lot from that experience in different ways. I may have been a little too interested in not showing ads to people, because people that were using it were ADHD. I didn't want to make anything more distracting, but people also really want everything for free when it comes to the B2C and the app space. So that was kind of a opposing needs. But regardless, so I got into the space that way, and I learned a lot in dealing with the data and that type of thing. And then I went back into industry and became a CTO at a company that made healthcare grade televisions. And they were dabbling in the interactive whiteboard space. They were looking to take these Android TVs that were that they had and build a new device that was essentially like, these were health grade TVs where it had the same, with the operating system where you could drive the menuing and stuff like that, and do some very rudimentary things of what we're doing. And so they had this idea about bringing this solution to market that would be interactive whiteboards and things like that. And so I came on board as the CTO of that company, and I did that for a couple of years and learned a ton about the industry. So I created their solution in that space, and I realized that there was a lot more that could be done in that area, and not just in the hospital area, but in other adjacent verticals that were related to healthcare. And the owners of that company, it was a very small company, weren't really into doing any of that. And so I eventually left to start a company that, taking what I learned in that company and previously, and building a solution that would serve not just the clinicians, but also the patients and also the friends and family, all in one overarching solution. And so I left and started with a blank sheet of paper, and went through a process. And I actually brought in the team that had helped me develop my original app solution way back prior to me joining that other company, and went to work and designed out a solution that I knew was badly needed, and we were able to bring it to market. I got our first client, and that went really well. And it's just kind of gone from there. So we're installed in hospitals all around the country, and we're actually in the process of installing one of the largest hospital networks in the country right now. I can't say the name specifically because the project is in progress, but many thousands of hospital rooms throughout the system.
Wow.
So
that's awesome.
It's been that solution. They kind of pushed us even farther because we were actually brought in by a innovation consulting company, healthcare innovation consulting company that hospital system had hired to find the best solution in the market for what they were trying to do, because they wanted to build the hospital room of the future. And so this company interviewed us and 7 other people, including major household name vendors. And we won the deal because our solution was so much more flexible than anybody else's. When I designed it, I built it as a platform upon which you could create solutions. And that platform allowed us to be able to very quickly integrate with other technologies and add new features. And so they were like, we need you to make it so that the patient can just speak to the device, set my visitor status to no visitors and have the system do that, which is, basically building our own smart home assistant, but for the hospital, and keep it all locally because nothing can go up to the cloud, right, for security things.
So what's the cool name you give it? Like if you're laying in my hospital bed and do I say, hey, vizabli, or what do I say? Like, is there
actually the name? You say, hey, Vizzy. Vizzy.
I knew it. See, it was kind of a half joking question, but I knew there had to be something cool there.
Well, that's what's called a wake word, and it has to be very very unique and specific because the system is always listening for that wake word and then replies back. And there's no AI behind it. I mean, it's just natural language processing, and then that type of thing is certainly on the horizon.
So as being an entrepreneur, obviously you're in your mind, you're always an entrepreneur, right? It's kind of one of those things you can't turn off. And because I get that too. I've always said, I just need my $1 million idea so I can break out and make it work.
It's never a good time, just like having kids. There's never a right time for doing it.
So I imagine it's kind of like cutting cord. That scariest moment is when you say, okay, I'm setting off now. In that first day is probably the hardest one.
Yeah.
But how do you prepare for that? And how do you know, like, or is it just like jumping out of a plane? You just got to go and do it.
It's, I would say it's a little bit of both, to be honest with you. Like you said, if you're an entrepreneur, you're an entrepreneur. And over the years, I spent a lot of time in consulting, running business practices. Like I used to, when James and I were at previous consulting company, I was managing their web development and emerging technologies practice. And so I gained a lot of business knowledge by being an intrapreneur, if you will, running a lot of business units within these organizations. I ran a R&D lab for another company that was from a serial entrepreneur, launched products under that R&D lab. So I got some experience doing that. But in all the time that I was doing those things, even from my earliest career, when I left the military, I don't have a college degree. I'm a college dropout, right? So I dropped out after my freshman year because I was majoring in beer and parties, and decided I needed to really kind of get myself focused. And so I joined the Coast Guard full time. And during that time, I got married, and I decided that I would go and get some real world experience and then go back to college on the GI Bill. And so when I left the military, my wife was in college at the time. And so I went and joined NASDAQ in Washington, D.C., and started off in like their, IT microsystem support department. And eventually, I kind of moved up the chain there to the point where I was working in a group where we did all kinds of basically setting corporate standards for technology, which was kind of the geek's dream job, right? You got to just go out and find new toys and play with them and see if this was the something that would be useful to the enterprise. And I somehow got involved in this emerging technology called the World Wide Web, and how that could potentially be used in NASDAQ and the parent company NASD.
I think I've heard of that World Wide Web thing before. I don't know.
Yeah,
heard about it?
It's catching on.
Yeah.
I think it'll be big someday. But
maybe.
So essentially, I built one of the first corporate intranets using this technology, and then I became the webmaster for NASDAQ and I was the lead UI developer for the NASDAQ.com 1.0. And I saw TV ad that actually showed my work on TV, right? So it was NASDAQ's TV ad, and it showed the homepage, and it says NASDAQ has a new home page. And, this was like mid-early 90s. And I got such a thrill out of that. And I was like, I love creating products. I really want to do that. And I love the internet. I love the technology. I was actually doing internet work in the Coast Guard way back in the day, connecting various Coast Guard sites along the network. So I had learned technology. I guess that's an important thing to understand. While I was in the Coast Guard, I became after I was down in Florida doing search and rescue and law enforcement, which was a whole different experience. And then I went to school to become a marine science technician in the hope to become a weather forecaster, which is one of the subspecialties of that job. And when I graduated from the school, they didn't have any weather jobs available. And they were like, well, you can go to Puget Sound and wipe oil off of rocks, or you can go to Coast Guard headquarters and do computers. And I was like, well, it's a pretty easy choice. So
good choice.
You could have ended up in a Dawn commercial, though.
Yeah, I could have
the other way, holding the little duck.
True.
Yeah, those are my hands. No,
but even from those early experiences, when I started at NASDAQ and I was working on doing this web stuff, I had this idea of, man, I could really create like a website that would let people find apartments. And I talked to my boss at the time. I'm like, what do you think about an idea like that? And he's like, nobody that lives in an apartment can afford a computer, so nobody is going to want anything like that. And I was like, and I really respected the guy. And he was right, but I just had this vision of all these things that could be done. And I sometimes wish that I could go back and punch myself in the head.
It's amazing how, like, certain people, they don't think outside the box when it comes to using technology. And
yes.
And I know James and I have run into this at places we've been at as well, where you make a suggestion, I can see this going this direction. People are like, oh no, that'll never happen. And then 2 or 3 years later, it's like, oh, look what everybody's asking for. And type of thing. And like the apartment finder is like, I've used an apartment finder before.
Sure.
And I'm like, yeah. And it's like, oh, this is awesome.
But I could have built that in 1993.
Right.
But I didn't feel like I knew enough about, and I had a ton of respect for my boss, and I still do. He's a great guy, but I probably should have listened to my instinct and not other people. But I didn't know enough at the time to realize that that thinking out of the box about the technology is kind of a rare thing, and it's not for what it's worth. It's something that I really love. I've always been like, I ran the emerging technologies practice, and so I always have these cockamamie ideas about how new things could be done or other things could be done better. But at the time, I just, was like, yeah, you're right. It's probably a dumb idea, and shelved it and went on to do other stuff. But I've always had that entrepreneur. I know this is a very circuitous route back to your question, but I've always had that kind of entrepreneurial desire to build things, build new products. But I also never really had the guts to just, not to leave industry and start building stuff. I mean, who am I, right? I don't know anything about running a business or whatever. And that was always the mindset. The older I got, the more I realized that the vast majority of business people, even the ones with like MBAs and whatever, they're just kind of following a prescribed script of things that they've learned. They're building on a lot of times what's already been built upon before without questioning. Is there a better way of doing this? It's not so much about creating new things. It's about making things more efficient or making things more profitable. And that kind of thinking really just, it ate at me. It drove me crazy, because I saw so many potential ways to make the world a better place. And be able to make money doing it. It's just not a mindset that you find in the business world. And a lot of times what you'll find is just the opposite. When people get some modicum of success, then they stop trying to create anything new and rest on those laurels. And, BlackBerry, right? Everybody had a BlackBerry at the time, right? And they were super successful.
The cash cow, as they call it, right? They
right,
keep milking
exactly.
the cash cow. Yep.
Exactly. And they stopped spending money on innovation and pushing the product forward because, hey, they're the only game in town, right? And all of a sudden, here's Apple and a little bit later Google, and ate their lunch for them. And by the time they realized what was happening, they were too late.
Now BlackBerry's just a jam again.
Yeah, exactly. It's not my jam, though.
Right.
Sorry, I had to do the dad joke there myself.
Well done.
Yeah. Jump on in. The water's fine. Yeah, and I think I've actually used in a talk before, where I was talking to a bunch of young developers. I said, you got to think of yourselves as being paid inventors, right? Mm-hmm. You've got to be thinking about the next solution and beyond what the ask is, so that we can keep moving. Because there's that trend out there of innovate or die, right?
Yeah.
Because you can't really sit back and rely on that cash cow to be bringing in money day in and day out. So if you're not adapting, you're dying. Type of.
No, absolutely. And anything that you can create when you become the market leader, everybody else looks at it and goes, "Oh, that's a good idea," and they've been successful, so let's do that too. And then pretty soon you're in the you're just one of the of a number of solutions, right? So if you look at if you've ever seen the movie Glengarry Glen Ross, where the Alec Baldwin character is like, ABC, always be closing, right? That was his mantra. My ABC is always be creating, right? Mm-hmm. Always be looking at the next thing, looking at the market, looking at emerging technologies, especially, and seeing what you can create, even if what you start creating doesn't really lead to anything. The knowledge that you gain from that is the foundation or the seed for your next great idea. And if you are pigeonholed and you're just, in a cube, doing the same, AS400 programming over and over again, eventually that's all you'll ever be able to do. And so essentially, I just got, my entrepreneurial itch and my desire to create new great things and get paid myself for it as opposed to doing it for customers, overrode my intrinsic fear of failure. And I just decided, you know what, it's time to make it happen. And off I went, and then I didn't make it happen as well as I would like. So it's like, okay, well, now what? Well, back to the industry, try to keep this alive, and get a steady paycheck, and come up with my next thing. And that's essentially where it is. The second time around, it was a lot less scary because I already knew a lot of the what to look for, and learned how to made a lot of mistakes that I learned from. So it made it a little bit less scary to do it the second and third and fourth time. So
So let's say I have this idea, okay? We'll call it some type of device or software concept idea. Like, what kinds of advice would you give to somebody that says, I want to build this and I want to market this and I want to make this my company? What advice could you give somebody that has that?
I would advise first, don't start with a what, start with a why. What is it that you're trying to do, right? The device or the software idea that you have this idea for, what is it trying to solve? What is it trying to improve? Why do you care about it? You need to have a why to get people on board. A what is good, but if you've ever heard Simon Sinek's people don't buy what you do, they buy why you do it. I think that's a very, very true statement. If you want to get help from people, if you want to get friends and family to help fund your idea, if you want to get angel investors, if you want to get other businesses, find customers, you need to have a solid why, why this is essential, what the problem is, and why you're the right person to fix that problem, and how it's going to make the world a better place. You have to have the passion for what you're trying to solve. Then you look at, okay, not just the initial idea I had of this gadget doing this thing, but what other things can I do to answer my why? And that way you're not trying to create a solution that's looking for a problem. You're actually creating a solution to something that is there, but you're not pigeonholing, tunnel vision yourself into saying, I'm all about creating this mobile app that does this. Now it's like, I know this mobile app is going to fix this why, but I could also create a wearable that could do that, and I could also create a web app that could do that, and I could create some other thing that and your ideas will start to expand because you're not focused on the what, you're focused on the why, you're focused on solving that problem, and so that mindset always will help you tremendously in having a broader focus, and you have to stay focused, right? Just because you come up with all these ideas doesn't mean you have to, dabble in 30 things. You find the one thing that's going to create the most impact, it's going to help the most, and you focus there, but you design with the idea of how it's going to expand and what things you're going to be able to do. And so in that type of space, you can get people excited, right? You can get potential employees excited. You can get potential partners and customers excited. You can get yourself excited because, entrepreneurship is not easy. And there are days when, I wake up and I'm like, why am I putting myself through this? It's, blah, blah, blah. And, you need to have that passion about what you're trying to create or solve to be able to get through those tough times.
Yeah, and on that point about having the why, even go beyond just like one why. We used to try and do a 5 whys model, like drill down with additional whys. So, it's like, why would somebody want this? Well, because of this. Well, why do they need to do that? Well, because of this. And then it's like, well, why don't they just do this? And it's like, oh, because this would be, da, da, da. And if you can get to 5 levels of why, then you probably have something pretty solid on your hands that is a need that requires a solution.
Yeah, and that's a really great way of vetting your initial why. I think when I talk about a why, I think it's more of a, it's your mission, right? And that's every mission you have to validate whether or not you're completely insane and you need to step away from it. And that's when you get into those whys, like, well, why would somebody want to do this? Why would they pay us to do this? Why wouldn't they go with something else? Why hasn't anybody else done this? And you'll find a lot of people, they're, and a lot of people that love you and want to help you and protect you will be anti-innovative, right? They'll be like, why would you want to put your family at risk? If this was a good idea, why hasn't anybody else done it? If everybody else is doing it, why do you think you can do it better?
Why do you want to start this at your age?
Yeah, exactly. I can give you 100 reasons why anything won't work without even knowing what the problem is, right? If it was a good idea, somebody else would have already done it. It's going to be too expensive. It's too risky. And the people say that because they don't, new things scare people, and especially in hospital technology. Oh my God, dealing with the culture of no in a healthcare setting is it's astounding that they are even using computers in the hospital, just because of how cautious and risk averse people are.
I imagine you run into the tradition problem as well a lot there too. Like, we've always done it this way. Why would we change?
Absolutely. Sure. If that was the case, then leeches would still be used for trying to solve problems. And some of it's also ego driven, right? And especially in the healthcare industries. If you know anything about the hand washing, doctors were just very set against having to wash their hands throughout history. It was insulting to say that they were dirty, it wasn't until the mid 1870s, a hospital in Vienna noticed that doctors who were working on cadavers and then went to deliver babies, the mothers and the babies would die a lot more frequently. And so the person there at that hospital finally put an edict down saying, you must wash your hands before you deliver babies. And guess what? The mortality rate for babies and mothers went way down. But you have to provide that kind of information to people. And I think you're going to see a lot more of that nowadays, even with like AI. Recent studies just in the last few days came out from Stanford where ChatGPT was actually able to better diagnose something from a medical record than doctors were. Right, ChatGPT got it 90% of the time, and doctors got it 76% of the time, something like that, the mid 70s.
So it's interesting you bring up AI, because that was actually kind of where I was looking to go next, was especially with like the entrepreneurship and the biggest thing being AI that we've heard about is kind of, I've seen it equated to the beginning of the internet is this AI trend.
Yeah.
So, talk to us a little bit about like using AI as a tool versus as a product feature. Like, how could we differentiate and use it in the different spaces, do you think, in this medical field?
I think in the medical field, it's going to be a challenge for any number of reasons. There's a ton of risk averseness, obviously, like I've said, in that whole industry, and that risk is not only about data protection, it's also about misdiagnosis and basically having making mistakes in the health environment, and I think there's some job protection issues as well. So I think of all the places that AI is going to struggle for adoption the most, it's going to be in the healthcare space, and I think that's probably in the state that AI is in right now. That's probably a good thing. I think it can be used as a tool. I think it can be used as an assistant in healthcare for doing things like, aggregating data and looking at patterns and finding trends and that kind of thing. But I wouldn't put any faith in it doing much more than that. I mean, diagnosing a thing, I think that's a tool that a doctor should be able to say, look at my case file and give me a diagnosis. But nothing, you can't just take that and say, okay, prescribe this medication because ChatGPT told me that, right? You have to have some experience level, right? The human level experience. So I think using in a AI in the medical industry, I think is going to be for a long time in the area of being one, doing natural language processing, NLP. So nurses can chart into the microphone in the room. Like we were talking about, the patient right now has the ability to speak to the, hey, Vizzy, turn on the lights or lower the shades, or set my visitor status to no visitors, right? And these are not life safety type things. If you chart wrong, that it misenter data into the chart, and somebody uses that data to change a medication, something like that. I mean, that's a life safety issue, right? So I think it's going to be in dribs and drabs, and it's going to take a huge ton of vetting. So it's going to be more providing doing the scut work that nurses don't want to do. They'd rather not type, right? They'd rather just speak while they're actually doing the round, have that data go into the medical record, but they have to have that validated by somebody. So you're going to see AI doing things like that and then being validated by a human being before it gets put up into the system.
So similar to what we're seeing in other professions too, like you've got like plugins to your IDE that are helping you code and do those things, but it's kind of go ahead and give me what your thoughts are, and then I'm going to make it actually work.
Right. I'm going to make my own decision, but I want your feedback on it. Right. And yeah, I mean, I use, like every other developer, I'm imagining, I use AI as a tool, to do a lot of documenting my endpoints, and maybe I'll highlight a block of code and say, analyze this and see if this can be done more efficiently, or whatever the case is. But you still, at the end, you're responsible for that thing. And so, I would never ask Chat GPT to fly my airplane, or make medical diagnosis without a human being also being there to be able to step in and do that. And it's really, really good at doing things that would require, analyzing a large amount of data, right? So you can look at a patient's medical history that a human doctor just doesn't have the time or whatever to do. But you look at a 20-year history, the Chat GPT can go through that in a couple of seconds and say, well, based on over the last 20 years, all these admissions have this one thing in common. Maybe we should be looking at that. And then, surfacing that to the doctor. Oh, I've been thinking it's this, and it's actually lupus or whatever, but I never, saw all of that together. So I think, that's the place where it's going to be used the most as an assistant. But it's going to be a long time before you have automated robot doctors that are intelligent coming in and diagnosing and prescribing for you.
So another profession that we've claimed is not going to be replaced by AI. So that's a good thing.
Mm-hmm.
Because that was the big thing when we heard AI was going. It's like, oh, it's going to replace all the developers. No, it's not. So now we know from previous episodes that lawyers aren't going to be replaced by AI either, and now doctors. But I'll tell you what, if AI can speed them up, so I don't have to wait 6 months to get a physical, that would be fantastic.
or go through a year of try this, try this, try this, let's try this med, that
that's
med.
The worst. And then have to wait 3 months between visits. Yeah.
Yeah. If I could just get it so when I showed up to my appointment, I didn't have to wait for 2 hours in the waiting room, that would be certainly a huge step forward. And truthfully, that's the kind of thing that AI can help with, right?
Yeah.
Doing the logistics of doing that. Hospitals are really bad about trying to clear beds. They have a patient needing to be discharged. Well, they've got to go through 30 different things to get a discharge, right? The doctor has to come in and talk with them. They have to have a social worker maybe come in and, do you install the rails at your house? You have to wait for these people to get this back and these papers. So being able to use AI to optimize that process and turn beds over more quickly, it's going to help the hospital. But again, it's not a life safety thing. I don't want, and I think most people would say at this point, the technology is just nowhere near mature enough to rely on it from a life safety perspective.
I wouldn't want it. I wouldn't want it making medical decisions for me. I know that much.
Yeah, exactly.
I think where generative AI is in, as you said, Rich, is being able to look at information and maybe because of the way it's built based on vectors and similarity, it can find connections between things that our human brains might not be able to as quickly as easily. I use it for I'm thinking through this situation. Here are the options I'm considering. Is there another thing I should be considering? And it's very good at that sort of thing. So maybe from a medical standpoint, I can think of Dr. House sitting there at his whiteboard, right? He's got his 3 doctors there. You could ask ChatGPT, what are some of the possibilities? But you still want to do the actual test, right? Oh, go do a lumbar puncture, go do a blood test, go blah, blah, blah. And by the way, Dr. House would say, it's never lupus. So you can just...
right.
It's never lupus. So.
It's never lupus.
Didn't he hide his drugs in the book about lupus or something like that? And I don't know. There was
something like that, yeah. Is Vicodin.
Well, and I think another place that AI can be used in this industry is in research, right? I mean, it's using it to do, folding proteins in unique ways to create drugs and stuff. But what my hope is, and again, getting back to my whole background with neurodivergency, right? I would love to, I feel very strongly that ADHD is part of the autism spectrum, right? I've got a child with autism. I've got 3 children with ADHD. And I see a lot of overlap in that, and it's not right now, and that's fine. It doesn't really need to be. But I feel like from a epigenetic standpoint, there's genetic propensity towards certain things, and then those genes express themselves based on environmental things, right? And I feel I'm hopeful, and I may be wrong in this, but I'm hopeful that by feeding a huge corpus of data into an AI thing about people with a specific diagnosis of ADHD or autism, and as much data as you can about those individuals, that it can find a pattern of, oh well, gee, everybody that whose mom drank Diet Pepsi and ate Snickers bars during the pregnancy ended up with, whatever the case is. And don't Mars and Pepsi don't come after me. I'm just using that as an example. But, the net of it is there's, my mom had ALS and horrible disease, and would love to find a cure for that. But I think there's an epigenetic predisposition for that as well, because her best friend, who was also a nurse with her at the same hospital and went to the same nursing school, she just got diagnosed with ALS as well. And the chances of that is astronomical. So I'm looking at it and thinking, what is it about, and they're like best friends. So they also they co-owned a lake house and all this stuff. So they were around a lot of the same environments, both in nursing school and in the hospital and out at this, this lake. And they spent so much time together. And for the 2 of those things, which is a very, very rare disease as it is, for the 2 of them to end up with that, there's got to be a correlation, right? But it's so much data. There's so vast amounts of data to try to find that it's just, I just don't think it's humanly possible. So I'm hopeful in the future AI will be able to process all that data and be able to look at it and say, aha, this and this together, here's this correlation. And guess what? It's not vaccines that cause autism. It's other things. But having a computer that actually has real unbiased ability to look at correlations and come up with potential causation, to me, that's what the most exciting thing I think AI can play in healthcare.
Computationally, we're absolutely there. It would be a matter of just gathering the data, right? All the exact data point from 2 different people throughout their history of their life and all that kind of stuff. I think that's going to be our big problem is coding these people into a big vector, right? I mean, we did hundreds of billions of data points on these vectors for the large language models. So computationally, absolutely, we're there if you can get the information. But yeah, so it's just I think that's going to be the key, is figuring out how do we vectorize everyone so that we can do this and help embed them.
Yeah, and vectorization is a great application of AI. I mean, I'm using that. You were talking about how could this be used as a feature, I'm developing some solutions right now, a recommendation engine that is based on a pretty sizable sample of data, and using AI, through the API to vectorize that data and put it back into a vector store, and then use that for retrieval augmented generation in my thing. So when the consumer is of this chatbot is asking for a recommendation on something, it can look first at the tool, the RAG, and look for products there, and retrieve that data, and then it can use the internet as a tool. Like ChatGPT has the internet API, and it can actually control your computer now, which is kind of crazy. But but it has a tool to go out and research on the internet, and it has its own built-in training. And so being able to use AI to pull all of that data together and then clean that up and filter it and summarize it and bring, pull that, average things out and say, well, if you like this, then you'll probably like this. That's a great use of AI, and that's one of the areas that I'm focused on right now for a particular startup venture that I'm working on. And then also being able to use AI to create agents to go out and continuously keep my data up to date and revectorize data and stuff like that is super important, because that's a ton of kind of scut work that I would have to pay a person to do that I can pay AI to do instead. So
this has been a really good conversation, and I've enjoyed talking with you. We need to move on to our next segment: ship it or skip it.
Ship or skip, everybody, we gotta tell us if you ship or skip.
So the way ship it or skip it works is we're going to throw out a topic, and you either say ship it, as in, yes, keep this, I like this idea, or I like this technology, or skip it, as in, no, we don't need to be doing that kind of stuff, or it's not ready, maybe in limited applications. So with our first one, James, you want to give us our first ship it or skip it topic?
Yeah, I was trying to come up with stuff related to specifically around the startup culture and startup, that world for you, since that's a big part of your world. What about like skimping on code quality for getting your MVP out to market? What do you think about that concept?
Ship it. I would say that technical debt is something that a lot of startups contend with. But if you want to cut corners on the back end to be able to get a product out to market quickly and get validation of, product market fit and things like that, you could spend a lot of time creating super perfect code and then have it just not be well accepted in the marketplace. So get it out there, get it tested. If you look at Eric Rice's the Lean Startup, it's very much that model of iterate often and see what works, and then go back and fix up the stuff that does, but don't spend too much time working on something that just may not have the legs in the first place.
I'm gonna be a little bit towards the other side. I'm gonna say skip it to a certain extent. I agree with the don't gold plate it, but also don't create broken windows, because that first version, if it does have legs, it needs to go, then you've already got something that you have to go back and fix. So you're already incurring maintenance costs at the very beginning. So I'm more on the skip it side, but don't go crazy with trying to make it perfect on the first go around.
And I would say the viable, right? The minimum viable product. That's the question, right? I mean, you don't want to skip or ship things that are broken, but it's only enough to make it viable, not perfect, I think is more of my mentality.
Yeah, I think I'm ship it with, a caveat, obviously, like if it's security, you're putting people's information at risk or something like that, I probably would shy away from that. I want to make sure, but yeah, you absolutely can shift to production with debt involved, and you want to get you want to get that feedback loop going, right? You want to get something in front of your customers and learn more about, how is your product really helping people? Is it changing their lives? And I'm with you. Like us developers, we tend to want things to be perfect, and perfect often becomes the enemy of good, right? And we want, well, I'll just get it to 99.5% code coverage or whatever, no, just get it out there in front of the customer. We can clean stuff up later. And honestly, a lot of these solutions end up having to be rewritten for scale anyway when we get into B round funding and whatnot. So yeah, I'm with you on that. I'd say ship it.
Our next one is building a hustle culture for your startup.
Well, again, I think we're into definitions of what a hustle culture is. I would say skip it. I'm more of a passion culture, right? I want people to hustle because they're passionate about what they're building, not because they're afraid of losing their job or their equity. When I think of hustle culture, I think of, you've got to work 80-hour weeks and so on and so forth. That becomes a given if you have a good enough why, and people are bought into the mission. They want to put the effort into it. So if it's about everybody has to work for peanuts and 80-hour weeks, if they're not bought in, I say skip it.
I'm with you on skip it. I agree with you on the why. You absolutely want people bought in on your purpose. Why does your company even exist, right? And you do have to work hard. You have very few resources. You have to wear a lot of hats in a startup. I think making sure that the founders, it's going to be really hard to expect other folks to have the kind of buy-in or investment, and they're not going to be vested in your vision and your dream and everything as much as you are, because you're the one who tends to make the most money. So if they do have some skin in the game as equity or they can options and those sort of things, I think that does help a lot. But yeah, just expecting people to work 80 hours a week to make you rich, I would definitely go skip it on that, because that kind of culture is not sustainable. If you are going to build a business beyond the startup, stage or phase of your business, you can't sustain that with that kind of hustle culture. You're going to burn people out, and it's just not a fun place. It won't be a fun place to work.
Yeah, and you'll get a bad reputation in the market. You'll struggle to get good people and so on and so forth. So yeah, I want employees that are there because they love it and they've got skin in the game. So
Yep, I am also a skip it on this. Because if you've done well in hiring and done well managing the expectations, you shouldn't need to have this hustle culture, because everybody will be on the same page. They're all going to want to drive towards getting this thing out the door on their own without being told that they have to move faster. You don't need that person over your shoulder going, done yet, the whole time. And I do agree, it will burn anybody involved out. The expectation should be set up front that you're going to have to wear multiple hats. We don't have the kind of manpower in a startup to fill in all the slots. You're not going to have full teams. You may have to be QA one day and product manager the next day, and that's just the expectation. So come in expecting to have a change of hat at any given moment, but you have to believe in the product, and we have to move forward as quickly as possible without burning everybody out. And I really think with that passion culture, you need that play hard, work hard kind of mentality, just so that you can let go and reset. Because if you don't recharge the batteries, they're just going to go empty, and you're going to be dead on the side of the road. Right.
And I think you make a really important point about setting expectations up front. The last guy that I hired, I tried to talk him out of taking the position. So when he came on, he was actually working for Meta. And I said, you don't want this job. And here's why. And I went through all the reasons why this was, not something he would want to do. And in the end, he was like, I still want to do it. It's like, all right, well, then you know what you're getting into. But, I'm not lying to you when I say, it's high speed, low drag, wear a lot of hats, whatever the case is. And if you're not up for that kind of culture, then it's not a good fit. And so, yeah, I totally agree. You have to set those expectations up front, and that's part of building the passion within your team.
All right, our next one on the ship it or skip it list is relying on open source technologies.
Ship it. I do a lot of stuff with open source. I always have. In fact, we had a practice that I was running, which was our free and open source software practice. As long as you're using it to the licenses correctly, and you are keeping abreast of any security vulnerabilities that are found and updating, I think it's a great model. I like even more the models of that have commercial support behind them. Red Hat is doing stuff like that. We're using a database from it's like a free version of Mongo Enterprise from a company called Percona that takes the downstream community version of Mongo and adds all the enterprise features to it and releases that as open source, and then charges for support and services around that. So there's a lot of great ways that you can leverage open source. And truthfully, I think open is better from a security perspective, because you're going to have more eyes looking at it and people that want to make a name for themselves by finding vulnerabilities and fixing them. So you don't end up with vendors that recognize they have security vulnerabilities and just try to hide it.
Well, and you get a wider market of implementations too. So you get, a lot of times with open source, it's used in multiple different areas instead of just like a niche one that maybe a certain technology that is a pay for off the shelf might have.
Yeah.
So obviously, I'm a ship it as well. I've been using open source since I could. It started off because I was cheap. But as the community's grown and things have gotten better, it has proven to be more resilient, more commonplace, and you are able to find people that understand the technology a lot easier than if you're using something that is very niche, right? So, like a good example was like the Lotus suite of tools. I mean, there was always job postings for those, but unless you had an opportunity to work on it, you're not going to be in that niche. Where if you had open source tools in that you were using for your solution, you were easily able to find developers that had used it before, have used it for their own projects and things like that. So I think, there's that side benefit of being able to find folks that know that technology as well.
Yep, absolutely.
So this one's near and dear to my heart, I guess. And I see both sides. So I'm a longtime member of the Apache Software Foundation, done a lot of work in open source, and for the individual to get involved as the contributor to get involved in open source, you have to be doing it because you want to do it, right? You can't be getting into it for the money or anything, because it's open source. There's really not a lot of money in it. There can be if you do it another way. I guess the reason I brought it up is there's a lot of stuff going around or going on where companies will develop an entire business around an open source product, and they won't contribute to the, I'm doing air quotes, to the upstream, right? So to the core, to the root product, the open source product. And then they'll just build a business around it. And, you've seen all of this kind of, we're going to change our license so they can't make money off of our hard work and all that stuff. And that gets a little crazy. So I think there's a little bit of risk involved there. But I would encourage people, if you are going to be using open source, especially for startups and that sort of, contribute back as much as you can, be a part of the community, contribute things back. Where it starts to get a little wonky for me from a contributor level would be when those business folks that do contribute back start to kind of almost abuse their influence over the product and the project and kind of steer their own business interests into the open source thing, so that you're just basically feeding your own business interests. And that's where it gets a little ugly. And there are cases of that. At least I've seen it, and in my opinion, that's what was going on. But I do think I would use open source, but I would encourage people to absolutely try to give back as much as you can. Yeah, so the last one, this was kind of interesting. I was just kind of doing a little chat GPTing and of different things that could be controversial in the startup world. What about adopting Agile's or Agile slash Scrum in a startup environment?
Well, I'm going to age myself here, and I'm going to say both skip it and ship it, right? So my modus operandi for things is to use a waterfall approach until I get to the development. So discover, design, develop, deploy, right? The 4 Ds. I think discover, design, and deploy are great ways for using a more traditional waterfall approach. I think iterating over a set of development during the development cycle is a smart way of doing it. So generally the way that I've done things is I will create a project plan in Gantt charts. I'm old school, to try to get an idea of scope and cost and timelines, and then go in during the development phase and use. We've used Trello pretty successfully, more of a Kanban type thing where you're moving cards from one stack to another. And during that phase, that works really well to keep everybody on the same page, and then people can pick up other things to work on if they run out of things and so forth. So I do that type of approach. So I'm not sure if I can say ship it or skip it, because I think it's not an either or. I think it's an and.
Yeah, I am a ship it on Agile, skip it on Scrum. And with some of the same things, you need to have your discovery phase in there. Once you've had a successful discovery and you move into continuous planning, and then with that, I think a Kanban methodology is better for a start, because then as the work comes in, you can just pull off the top. And if you've built your team in a startup fashion where you've got those people that are wearing multiple hats, it's just take the most important thing and run with it. Just go, 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 right? And just burn down that stack, get to MVP, rinse and repeat, and then move into your iterations. As you grow larger, then maybe Scrum works better for you at that point. But I think, for that sake of being able to move through and pivot quickly, I think that the Kanban is going to be more of a better style. I know with projects I do that I'm with small teams and things like that, that Kanban kind of thinking is better, because then I don't have to worry about the management of sprints and trying to time-based things and all that, and having the ceremony around something that, as a startup, you just don't have your ceremonies in place yet. You're still trying to figure things out. So I'm a ship and skip as well, but on the Agile side, yeah, I definitely need that discovery up front so that we know what we're doing. You got to have that discovery phase. And we just did an episode all about discovery and why it's important. So, go check that out. Our little shameless plug there.
Absolutely. Yeah, I mean, anybody who's talked to me for 5 minutes probably heard me say something along the lines of big A agile versus little a agile. So I'm all for agility. I don't know if I'm for, what I know we're a consulting company, but I know consulting companies get a bad rap for, selling big A agile, right? You got to come in and do these sprints. And that's been a very lucrative business for folks through the years. And it's caused agile to get a bad name. But I think if you stick kind of to the principle level of agile, I would value that in a startup, and I think it's good to get those habits going early and not rely on, we've got to write down everything in requirements definition and a huge document in order before we can start writing any code or getting anything in front of our users. So that analysis paralysis, it just gets worse over time. So I would definitely build in agility into my company. if I was trying to get a product out to market in front of my customers as quickly as I can. I think that's important. Scrum, maybe later. Maybe that's a big maybe. Maybe not. One of the things Scrum they say that it helps with is that kind of that cross team planning and coordination is what Scrum is supposed to help with, and even like SAFe or something like that. But stick to the principles. Go Kanban, stay lean. I would be careful with Kanban. They always say us developers. We're like a gas. We expand to fill up any space you give us. That's that's what we do, right? That's why the sprints don't work if they're 4 weeks, 6 weeks long a lot of times, because we're like, I got 6 weeks to do this one little story. No, you don't. You got as long as it takes you to do it, right? Just do the work. So anyway, yeah, I'm ship it on little a agile or agility as a principle.
Yeah, I think it's in a lot of. I think what all of us have said is skip the dogma and go with the spirit of it. And that's exactly.
Be pragmatic, not dogmatic. I've said that to our folks a lot.
There you go. That's perfect.
Okay, I believe it's time for the lightning round. So our lightning round is going to be a series of quick, rapid-fire questions. I guess quick and rapid is redundant, where we're going to each give you a question. We're not looking for long answer forms, just a snappy little answer. There are definitely some right and wrong answers. If you've got the little seat shocker kit that we sent out to you, wrong answers will be buzzed.
I was told there'd be no test involved here.
We lied.
We just said there would involve no math. There will be no math. That's all. Yeah.
So there's no math section, I don't think. I do see a question about pie in here, though.
Pecan pie over apple every time.
Yeah. All right, James, why don't you kick us off?
You want to go first? All right. Favorite childhood TV show?
The Flintstones.
What's the most boring thing ever?
Bowling. Watching bowling on TV.
Oh.
That's probably a better way of saying it.
Do you know how to salsa dance?
No. Or any other type of dance.
Are tomatoes a fruit or a vegetable?
They are a fruit.
What was your first celebrity crush?
Oh, gosh. Farrah Fawcett.
Mm.
Had a poster of her in my bedroom as a kid. Yeah.
We would have also accepted, was it Heather Thomas from The Fall Guy? Was that her name?
Is that Locklear? Heather Locklear? No.
Heather
the lady
Locklear
from
is a
The
good
Fall
answer,
Guy.
too.
Yeah, that's another good answer. We would have accepted any of those.
Okay.
So
well,
no buzzing necessary. For that.
I haven't gotten zapped yet, so I guess I'm on the
you're
right
doing
track.
you're doing great. You're doing great.
Yeah, I think mine was Daisy Duke.
Okay.
Oh yeah.
Yeah.
Yeah, that's acceptable. It could be Mary Ann from Gilligan's Island too.
Mm-hmm.
Yeah. Is it grammatically proper to capitalize the names of the seasons?
Yes, I would say so.
Man, you're making this difficult.
I'm throwing the hard balls today.
I know. Do you have any friends taller than 6'4"?
Yes. A good friend of mine, Joe, is 6'7".
Good night.
Yeah.
Tall.
Dan is the one I think of when I think of over 6'4". Guy had to duck in every room he walked into.
Mm-hmm.
My son's 6'7", and he's going to Japan in a couple of weeks, so it's going to be an interesting experience for him there. 6-month internship in Japan, so he's going to come back hunched over.
Yeah, right. He's not going to fit anywhere. Most embarrassing store you might be seen shopping at?
Wow, that's a great question. I'm going to go with, I would have said Kmart, but I think they're out of business now. So
yeah.
I guess it would be the discount liquor and cigarette store across the river.
This is a timely one. How do you feel about cranberries?
Oh, yeah.
I like them jelly, but I don't like them cooked. So I like cranberry jelly out of a can, plop. But that's about the only way I like them.
Now, and why do the ends taste better? You know what I mean? Like, why is that?
I've not experienced that. That's the first I've heard that.
We always fight over who gets the ends that like molded to the.
Well, now I'm going to have to taste test it.
That's where all the botulism is.
The botulism settles.
It's that extra flavor there.
At the seals of the can. That's where all the.
Okay, that's good. That must be what it is. That explains the tick. Yeah.
All right, this is kind of relevant along those same lines. Along the same lines, do you Instagram your food?
No, I don't Instagram at all, actually. So no.
I think that finished our lightning round.
We're done.
You survived.
Wow, I didn't get shocked, so I'm shocked that I wasn't shocked. So
you did great. You did fantastic. Gold star.
Wow, thank you.
I think you're the highest score this week.
Okay.
Podcast.
Well, good.
Yeah, definitely the highest score this week.
Yeah, and this is your only one this week, right?
It could be.
So far, the day ain't over yet.
Yeah,
right.
That's awesome.
Well, that concludes this episode of the /, where we lean into the future of IT. Make sure you subscribe to this podcast for future episodes. I'd like to thank our guest, Rich Schramm, for talking with us about entrepreneurship in the healthcare industry. I'd also like to thank my beautiful co-host, James, and all of our production staff that make this podcast possible. I'm Aaron Chesney. Thank you, and stay curious.